Continuing our review of major diagnoses. Remember, everyone who is admitted to hospice has to have a terminal diagnosis and an evaluation of the specific criteria of that diagnosis. Needs to paint a picture to Medicare that the patient is ready and meets the hospice admission criteria. So continuing this review of the specific requirements, we'll come to cardiac disease. Now remember, the first 2 points must be present in this case, and the patient has to have been optimally treated with a poor response, or perhaps they're not a candidate even for that treatment, or they perhaps have declined the treatment. They don't want to go back to the hospital for diuresis or perhaps cardioversion. In fact, see our recent blog and Brenda's story about her patient Ed. Or number 2, their ejection fraction is less than or equal to 20%. There might be angina, chest pain even at rest, no tolerance of exertion of any kind, even talking sometimes. They don't have the ability to transfer unassisted from a bed to a chair, and they need assistance with all ADLs. They might be incontinent of bowel or bladder. Despite optimal diuretic dosage, the patient has an increased dependent edema. It may prevent to whole body anasarca, tight extremities, even serous weeping in the legs. The abdomen presses up on the diaphragm, which would also compromise their breathing. They may have sinus or ventricular arrhythmias, and they're resistant to treatment. There may be a history of cardiac arrest or resuscitation, or perhaps unexplained syncope or fainting regularly. They might have had a brain embolism or a stroke, which came from a cardiac origin. They might have concomitant HIV. This patient may be sleeping 16 to 18 hours a day, and they can have decline in cognitive function, and they are definitely progressing to a bedbound state. Remember, admission is not black or white. So let's just say the patient doesn't have an ejection fraction of less than 20, but there are so many other supporting diagnoses and conditions in the overall picture of the patient's condition and function that allow us to move forward with the admission to hospice care. Remember, it's not black or white. Be the detective. We'll move on to dementia in the next video, and remember, watch our blogs, our daily videos. The hospice care plan, we're there to support you in all your end of care needs.